Medicare cover you when you're outside of the US? The answer is usually not. But in this video, I want to talk about two different scenarios where there could be some coverage when it comes to international travel. And the first situation is if you're just traveling, right, for vacation. And number two is if you actually live overseas. So let's talk about how it works, what to be aware of so that you can get the best coverage, but also avoid any coverage gaps. I'm Emily with the Medicare Coach. We are an independent fee-based consultant helping our clients easily navigate the Medicare rules and insurance company options to do what's right for them to protect their healthcare rights as well as their retirement savings. So there are two things kind of be aware of, or really two main scenarios that we see when it comes to coverage, when Medicare coverage overseas. And the most common one that we see is people traveling. So let's talk about that one first. When you are traveling outside of the US, in most cases, Medicare covers very little to no international coverage. Now, there can be some exceptions, right? If you say live or you're traveling between the US and Alaska, going through Canada, and it happens that you have a medical emergency and the Canadian hospital is closer to you than a US hospital, then yes, Medicare would cover those services. So my point is this. There are some situations where Medicare could cover you overseas, but the scenarios are really small and usually not applicable to most. Now, there are certain Advantage plans or Medicare Supplement plans that could cover some overseas coverage as well. They tend to only cover medical emergencies, and you have to be gone within 60 days or only gone from the US within 60 days. So if you're taking a 3-month trip, this will not cover you for the entire time. Again, it has to be medical emergencies for the Medicare Supplement or Medicare Advantage to kick in. And there tend to also be a maximum amount that they're going to actually pay for your overseas, for your international health coverage. So I tell my clients, let's not assume that Medicare will be great coverage overseas. If you're a person who likes to have travel insurance, then you should probably still get your travel insurance. So while yes, there are some fine print saying that they cover it internationally, I don't think that we should rely on it in most situations. Now, for those of you living abroad, right, who live in another country, Medicare doesn't usually provide most coverage as well. As I mentioned, Medicare Supplement and Medicare Advantage might provide some coverage, but they usually have a limited that they'll pay out of pocket, and you have to be out of the country for only 60 days. So if you're living in, say, I don't know, Panama, you probably are outside of the country for more than 60 days, so it's not going to provide you a ton of value. Now, there are some facilities in, say, Mexico who do take certain Medicare plans. The way that they're set up, they'll accept Medicare, but it's a bit of a unique situation. So if you're living overseas, you should not rely on your Medicare coverage to provide you health insurance in your non-US country. Most of our clients who live overseas will still get Medicare coverage at 65, so they have options when they do come back. But it's important to be thoughtful on what your Medicare coverage is if you are living overseas. So again, Medicare does not provide a great or really much coverage at all when you're outside of the US, unless you're at a US territory, something of that nature. But it's still important to know how the rules work and how can we coordinate that with other health insurance so we can have the best healthcare overall. I'm going to include some extra resources down below to help you get a shortcut to Medicare to help you do what's right and best for you. So check that out and make sure you like this video for more inside tips when it comes to Medicare.